Members' motion with no legislative effect. Mr. Stanley Ng's motion on protecting the mental health of employees. Mr. KWOK Wai-keung will move an amendment to the motion. This council will proceed to a joint debate on the motion and the amendment. Later, I will first call upon Mr. Stanley Ng to speak and move the motion. Then I will call upon Mr. KWOK Wai-keung to speak, but he may not move the amendment at this stage. The joint debate now begins. Members who wish to speak, please press the request to speak button. I now call upon Mr. Stanley Ng to speak and move the motion. Mr. Stanley Ng. President, I move that the motion as printed on the agenda be passed. We have a densely populated city, and we are moving at a quick pace. We have many facing mental health issues. According to the electrical research paper, we have seen a huge demand for HA's mental health services. Mental health patients cared for by the hospital authority from 2019 to 2020 to 2.27 million people to 3,500,000 people in 2023-24. That is a significant increase. And we have a number of people faced with pressure from work, and they have suffered mental health illnesses as a result. The average is 16%. The FTU has all along been paying close attention to employee welfare, and we have recently launched a study. When we have the findings, we will report the findings to the public. The mental health of employees is crucial to social welfare. I would like to make 3 points here. It relates to social efficiency. According to the WHO's analyses, with increased enhanced mental health, they will have productivity increase. Otherwise, there will be absenteeism and loss of productivity. According to the OSH Council, they have a survey in 2020. We have some absenteeism and presenteeism. We have a loss of $5.97 billion as a result. You can see that there is a significant loss to society. We need employees to be healthy both physically and mentally in order to ensure there is productivity. Next, with proper mental health of employees, it will help with social harmony. According to Hong Kong Youth analyses, within the last 10 years, we have many suffering depression. The medical cost is over $2.51 billion. We have 3 million odd workers in Hong Kong. Apart from working, they are also parents, children, and spouses. They may even be breadwinners of their families. They face tremendous pressure. If they have to work overtime without compensation, it will lessen their contribution to their families, thus harming harmony in their families. It will not help with their quality of living. And not only are they affected, their family members, their children, their elderly persons in their families may also be affected. There is a rippling effect. And in turn, that will increase the costs of social welfare services, impeding the development of society. Also, protecting mental health of employees would be a core value of humans. As President Xi said, caring for lives, respecting people's rights is a value shared by many. And according to the WHO's report, mental health is a basic human right. While we are trying to increase productivity and we have rapid advancements in technology. If society does not respect workers fully, so that workers can have self-actualization while making contributions to society, achieving sense of belonging and satisfaction, this is not contributing to the core human value. Hong Kong has some deficiencies in protecting mental health. Right now, the OSH legislation in Hong Kong has inadequate protection for employees. According to the WHO, we need government legislation in order to ensure that there is a proper working environment for the mental health of employees. However, in the OSH legislation of Hong Kong, there is no specific mention of protecting mental health of employees. And the employment ordinance did not have any compensation for mental health problems caused by work. Employees need to prove that there is direct causal relationship between employers' negligence and their mental health problems. It is hard to collect evidence in this regard, and we haven't seen a single successful compensation case. Right now, there is inadequate mental health support for employees in Hong Kong. We only have the Joyful Healthy Workplace Scheme, and we also have the Mental Health Workplace Charter that only has companies sign up voluntarily. There is no support to SMEs even. What are these schemes for exactly? Do these help those employees who need such? Can we have a better understanding of the mental health data in Hong Kong through these? There's much to improve on. And according to the Equal Opportunities Commission's 2023 survey, only 12.5% of employees with mental health problems said they were supported by their employers. Both patients and persons in mental recovery will be protected by the Disability Discrimination Ordinance, but then they still feel somewhat difficult taking leave, or they fear being discriminated and they dare not apply in the first place. We have a long waiting time for mental health services in Hong Kong. We have inadequate manpower. There are very short consultation hours. With various of these issues, there is no channel for those with mental health issues to seek assistance, and we have probably had them miss the best timing for seeking treatment. I urge the administration to get a better grasp of mental health data in Hong Kong and compile a report, and we should start from the top level design in policy making and try to tackle the problem. The government should show its determination to implement reforms. We should also have a regulatory framework in the OSH legislation. We need to make sure employers have accountability in protecting the mental health of employees. For any mental health issues arisen from work, the employee should be offered compensation. There should also be regulation on compensation on overtime and the number of working hours. We should adopt a multi-pronged approach to adjust the provision of mental health services, and for enterprises that promote mental health friendly policies, we should provide assistance to them, including, say, the provision of mental health courses, mental health assessments annually, as well as providing persons in mental recovery some recovery support, such as adjustment of work, allowing them to have flexible work arrangements. The government should also provide subsidies for mental health services so that employees with mental health problems can get the help they need. We also need to provide training to mental health professionals so that there can be more intervention offered to those in need and help them adjust to work again. Later on, my colleague will talk about the FTU specific recommendations. This is just a starting point. I hope that members can attach great importance to protecting the mental health of employees and support my motion and Mr. KWOK Wai-keung's amendment. I so submit.
嘅待議議題係
And I put the question to you that Mr. Stanley NG's motion be passed. Mr. KWOK Wai-keung. My motion is my amendment is on protecting the mental health of employees. We're still in the first month of the new year. When we greet each other, we often said good health. But it's not just about physical health. You need mental health as well. You need mental health to function, to handle challenges in life, and to carry on with your life. I think the biggest problem of work is the long working hours. Well, heavens is fair. Everyone has 24 hours. If you spend more time on work, that means you have less time on other things. Employees understand that making a living is important, but if you sacrifice your me time or family life, then it's doing more harm than good. You don't want to look back on your life to realize that you only work. Long working hours will result in burnout. It may end up in a sudden death or harm to your mental health. The government said that, for sudden death cases at work is mostly to do with cardiovascular diseases. That is down to the person's lifestyle. But is burnout a cause? I think that the government should start compiling statistics on burnout resulting in deaths. Well, a lot of people talked about the right to be offline, whether there's any chance that it will be realized. I want to take this opportunity to discuss whether there is any possibility of giving employees the right to be offline or disconnected or be disconnected. It's not the case that when you're off work, you don't do any work at all, but the line between work and your personal time is blurred. Are you expected to work any time you are? And if you are required to work, should there be compensation paid? If you are off work and you still have to do a lot of work, that means, overtime without compensation will only get worse. Employers count every penny. If overtime results in additional operation cost, then employers will only ask employees to work overtime when there is a profit to make. Currently, there is no cost if you ask your employees to work overtime. Well, even though employers know that long working hours result in a drop in productivity, they will still ask employees to work overtime because that is done at no cost to them. Employees, if they work overtime, should be properly compensated. In Australia, in Japan, there is a mechanism for compensation. If it can be proved that the mental impairment is a result of work, then compensation should be paid. In relation to working women who are mothers, I think more support to be given to them. We have conducted some surveys. We realized that some working mothers decide to give up their work. This will reduce the labor force in our society. Being healthy is a basic right. The government should attach importance to that and to build in place a protection mechanism. We have to do some more to build up our labor force. we see the endeavors paid by Japan and Australia in a bid to improve mental health of employees. A policy with vision, one that is forward-looking, should focus on preventative work and try to reduce hazards. In the long term, there should be a proper policy put in place to make better use of resources so that we'll all be equipped to face challenges.
Secretary for Labour and Welfare. Deputy President, I thank Mr. Stanley NG for his motion and also Mr. KWOK Wai-keung for his amendment. Feeling stressed at work is a common occurrence. Of course, an appropriate level of work stress can be transformed into a driving force, prompting workers to give fuller play to their potential and enhance their work efficiency. However, persistent and excessive work stress may jeopardize the physical and mental health of workers, reducing their productivity and affecting their work efficiency. The government attaches great importance to the mental health of employees. Under the general duty provisions of the Occupational Safety and Health Ordinance, employers are required to ensure, as far as reasonably practicable, the safety and health of all their employees at work. Employees are also required to take care of the safety and health of other employees in the workplace as far as reasonably practicable. Here, health includes physical and mental health. Employers and employees are required to meet their obligations under the ordinance by taking appropriate measures to minimize the risks to the safety and health risk of employees at work, including the risk of work-related stress that may endanger the mental health of employees. However, the mental stress caused by work to individual employees and its impacts on their health is a complex issue. Apart from work factors, it is also related to personal factors of the employees. This is something that we all understand. This includes their personality traits, communication skills, ability to cope with stress and changes, and their personal health conditions. In addition, other factors outside work, for example, family, social, and societal factors, may also interact with personal and work factors to affect employees' ability to cope with work-related stress and their mental health status. As the mental health of employees is affected by many different factors, even though they are facing the same work situation, the pressure felt by individual employees and the impacts on their mental health may not be the same, and the treatment or follow-up actions required may not be the same. Therefore, if an employee feels too much pressure at work or has emotional problems at work, intervention should be made in an appropriate manner according to the actual situation and needs of the individual to provide suitable support. In order to effectively protect and enhance the mental health of employees, rigid across-the-board requirements and measures may not be the most desirable and effective way to deal with mental health problems. We also have to consider the feasibility and negative impacts of the relevant requirements and measures in actual operation. The government understands that the public is concerned about the mental health of employees. We believe that it is more appropriate and effective to enhance employers' and employees' awareness of the need to manage work stress and promote mental health through the concerted efforts of various sectors, and to provide them with the relevant information, resources, and appropriate support measures and services so as to assist them in dealing with issues relating to work stress and mental health in the light of their respective actual circumstances, and to fulfill the responsibility to safeguard the safety and health of the employees under the OSH Ordinance. Deputy President, I hope that through today's debate I can listen to more valuable views on protecting and enhancing the mental health of employees. I will listen carefully to members' speeches and then give a consolidated response to the motion proposed by the member in the concluding remarks I shall submit.
林振昇議員。
Mr. Lam Chun Sing. Thank you, Madam Deputy. First of all, I thank Mr. Stanley NG for moving the motion. Hong Kong is known for stress in work and long working hours. In some workplaces, employees are asked to do whatever they're asked to. A number of years ago, we have been voicing about workplace violence. Say, for example, someone answering the call at the jockey club betting center may be scolded for not hearing the bettor's instructions clearly. A lot of carers work during the day and take up another job as a carer at home after work. And these cases are only the tip of the iceberg. When workers are under stress, the problems are emotional problems, mental issues, as well as cardiovascular diseases. Mr. Stanley NG talked about legislation. Current legislation requires employers to ensure that employees will have their safety and health at work ensured at all times. Well, other than inhaling chemical substance or gas, what else does it mean when it comes to work safety? The Secretary has explained. Workplace safety includes mental health as well. If that is the case, does it mean the government did not do enough? Where do you draw the line? How do employers meet the legal requirements? What do they need to do to ensure that the workplace environment will not adversely affect the mental health of employees? What does it mean by reasonably practicable? Do large corporations have the duty to do more? If we refer to Australian and Korean occupational safety legislation, they all said that the employer has the duty to ensure that there is a healthy workplace to reduce stress, otherwise they will be legally liable. We hope that there will be a framework put in place. If employees say that they show signs of mental illness due to excessive stress, or if they are subject to bullying at work, the employer should, as far as reasonably practicable and affordable, put in place measures to handle that. The EOC Equal Opportunities Commission issued the result of a survey saying that a lot of respondents would like to have a flexible work hours so that they can go to see doctors if necessary. Employers should create an inclusive work environment to give employees flexibilities to ensure their mental health. The government can provide additional support to civil servants if necessary so that they will set an example to the private sector. Employees who are suffering from emotional or mental illness can go to occupational health clinic. But a lot of these cases will be referred to the hospital authority. The waiting time for these cases is already long. For stable new case and psychiatric cases, waiting time is 27 weeks. The longest is 103 weeks. So I hope that the occupational health clinics will enhance services on psychiatric or mental impairment so that patients don't have to go and wait in the public sector system. I speak in support of the motion. Mr. Jimmy Ng, if you live in the city, then you're under tremendous stress. A lot of survey and data shows that mental and psychological diseases is a time bomb. We need to defuse that as soon as possible. Lancet published a study saying that about half of the population in the world, when they reach the age of 75, will suffer from at least one mental illness. Previously, there was a survey on mental health of Hong Kong people. It's pointed out that the prevalence rate was about 13.3%. That means 1 out of 7 Hong Kong people suffer from mental illness. In 2018, the CUHK conducted a survey on employees, and they found that 1 out of 4 people may suffer from anxiety or depression. And the most serious group is 18 to 27 years old, at a rate of about 37.2%. A similar survey found that depression is quite serious. In the same age group, the prevalence rate is much higher than other age groups. And the main reason is because they are concerned about their academic result. Whatever your age is, you are under stress. It's not just those who are working. Youngsters suffer as well. I think there is a need for comprehensive policy to ensure mental health. There should be a roadmap. This is to ensure the mental health of Hong Kong people. How do we formulate policies? In 2022, the World Health Organization published guidelines on workplace mental health. Under the guidelines, there are recommendations to enterprises to put in place measures to train their employees to identify those suffering from mental illnesses. And there are also measures should be put in place to help them to return to work. I'm sure that no one will dispute when it comes to protecting mental health of of employees. But when it comes to legislation, they may have a different answer. Youngsters suffer from stress resulting in mental and psychological illnesses. Students have to take part in extracurricular activities, interest groups, as well as tuition classes. Well, do we say to parents that they have to limit the number of activities that they sign up their children in? And I think that there are more effective ways than legislation. We need to encourage parents to allow their children to relax so that they will work better. There should be more publicity and education. There should be guidelines put in place that tackles the root of the problem. Legislation will affect the operation of enterprises. Legislating for work hours and the right to be disconnected may not apply to every trade. It's difficult to run a business. If you are an employer, the mental stress is not any lighter than that of employees. You need to give them support. You need to have publicity and education. That's more important. Well, in relation to formulating measures to protect mental health, I think the Japanese approach is more practical. I support that. They have a similar work ethics and culture. What's going on in Japan? The government asks employees to conduct a stress test. Given the limited resources of SMEs, the government provides subsidies. I think that the government should draw reference from that. I support the motion.
Mr. Shanghai Lo. Thank you, Deputy President. First of all, I would like to thank Mr. Stanley NG for proposing the motion. Hong Kong has developed from a small fishing village to a metropolis. We have all along had the spirit of Lion Rock, and we work for long hours. We have seen in general that the mental health situation will worsen. I think we can include in the ESG framework some indicators of mental health of employees. Right now, we do not attach enough importance to the mental health of employees. We are at risk of our competitiveness being compromised by the loss of productivity. But this is not just a social responsibility. We need to understand that there is now transformation in patterns. I have actually taken part in a 2023 award ceremony for company having happy employee awards, and we have seen some companies working very hard to foster a happy culture for their employees. I think it is important to recreate some human values. We now treat workers as part of the cogs of the company, but we need to make sure if we can enhance mental health of employees, it has enhanced productivity of employees and innovation of employees. It seems that it would help if we protect the mental health of employees, increase productivity of companies. And there is a Belgian psychologist that said that we need to protect mental health of people because it is a part of the civilization. We have many quality migrants, top talents coming to Hong Kong. They face pressure because they need to adjust to the Hong Kong culture. That is added pressure. Let me first declare that I am the founder of the Top Talent Services Association. We have the talents facing several kinds of pressure. One, they are overworked. Two, they have trouble adjusting to the culture. Some had been separated from their families, and thus they are lonely. So it is important to make sure we can improve the mental health of talents as well. We need to practice talent management in terms of protecting their mental health. Last year, we held some Cantonese adjustment courses. The Top Talent Services Association also held a Cantonese activity, and they would have talents learning Cantonese songs. And that would help them not only learn Cantonese, but also help them feel happier. I think protecting mental health is a core company policy now. And we have seen changes in employer and employee relationship. Employers should be working with employees. And if employees are in distress, it actually causes for loss of productivity of the company as well. I understand that employers also face some pressure in mental health. In 2022, I understand that there was a Kowloon City incident where the owner hung himself due to some poor business environment, and many employees felt very regrettable because he was such a good boss to them. So I think after that, I have held an activity for employees to say thanks to their companies, and we had many enterprises support that, and I think it works both ways. We need to have more care for the employers, but also for the employees. There should be more positive interactions between employers and employees for the benefit of society. I so submit. Ms. Yong Ho Yan. Deputy President, I speak in support of Mr. Stanley Ng's original motion. We have workers face different types of pressure and increasing pressure. We have some figures here. According to the surveys, as Mr. Jimmy mentioned, we have many facing mental health problems, but 74% of them never sought help. It shows that in order to protect mental health employees, we need to do more, and it is very important that we do so. Mr. KWOK Wai-keung mentioned in his amendments that he supports comprehensively reviewing the employees' compensation ordinance. I think right now our legislative framework is slightly behind with the OSH ordinance. It requires employers to protect the health of employees, but there are no specific requirements, so that for the mental health of employees, they are often neglected in OSH protection. And for employees' compensation, it only covers compensation for work injuries, not mental injuries. Although under the common law, the employer must exercise due diligence to protect the mental health of employees. Right now, there is no successful compensation case in Hong Kong as of yet. We can see that the current legislative framework does not provide adequate protection and attach enough importance to the mental health of employees. We need to comprehensively review the employees' compensation ordinance and related legislation as a result. The Disability Discrimination Ordinance spells out explicitly discrimination against disabled persons. Employers, therefore, cannot cite the reason of one having mental health problems terminate the employment agreement with employees. I think that offers protection to those with mental health problems, but then we have seen in different industries, especially for high-risk industries, such as teachers, healthcare personnel, law enforcement personnel, carers, and social workers, they face tremendous pressure and they therefore face a higher risk of having mental health problems. 80% of teachers said they have great pressure, and 40% said they have fatigue, and 30% of nurses say they are depressed. Half of them said that they are inclined to leave their work. So these industries face the pressure specific to their industries. We need to make sure we provide adequate support to them. Under the existing framework, how can the government do more? First, with reviewing existing legislative framework, but also with helping employers understand what responsibilities they have in protecting the mental health of employees. The government should perhaps promulgate more guidelines to make sure employers to take measures to protect the mental health of employees. The government can also provide more support services. As I said earlier, we can study how the employees' compensation ordinance can have the occupational stress included under the scope of compensation so that we can provide adequate support to employees. We should also have a hotline for employees in need. We can also have mental health professionals providing assistance to companies. We need to enhance awareness, and we need to make sure people know that this is a part of employee welfare. We can perhaps also have health insurance schemes covering mental health services. The government should enhance services in both numbers and quality. We should also enhance public education and public awareness, and that should eliminate stigma on mental health issues so that persons in mental recovery as well as patients will have a more caring environment to live in and work in. Regarding what Mr. KWOK Wai-keung said about formulating working hours regimes and overtime compensation regimes, I think it is difficult to implement because different occupations have different working hours. It would be hard to set a particular working hours. Your time is up. Mr. Chan Kim-po. Thank you, Deputy President. With globalization and advanced technological advancement, we have seen great changes. We have seen if employees suffer bad mental health, it will cause for a loss in productivity. Employers are therefore have the responsibility, and they would want to protect the mental health of employees. I thank Mr. Stanley NG for proposing the motion so that we have a chance to discuss this. On a survey done in 2024 on a work happiness index, the index is as low as 5.3. The full marks is 10 points. Many are worried about the low pay. They think their pay cannot cover their costs. They face different kinds of pressure. One, heavy workload and bad work-life balance, worse in bad interpersonal relationships at work. And if we do not resolve the issue soon, many employees will suffer mental health. And according to the electrical information paper, we have 3.7 million working population. We are the second most overworked city in the world. The average number of working hours is 44.3 hours, and we have 30% of people working for 48 hours, and some even work for 60 hours. It is far over 48 hours. So we work more than we see our family. We should refer to the UK NHS's practice to have talking therapy for those suffering mild or moderate mental health issues. We should also refer to Spanish and Australian practices to conduct regular mental health assessments for employees. We can also set up in district health centers the conducting of mental health assessments to identify those in need. While these would help employees, we need to make sure we are tackling the root cause of the issue. Employees face pressure at work, so we need to resolve the crux of the issue. While this may sound easy, not many are actually doing something about this. We can have supervisors for every 3 to 6 months hold meetings with employees to understand their demands or difficulties. Many employees think that work is unfair. Some are working harder, longer. Some are not working their load. And we have also seen some supervisors not doing much. We need to have supervisors making adjustments and have proper assessments of employees' workload. We should also create a good company culture to prevent shirking of responsibilities. The employers play an important role in this. They should promote a fair and mutually helping working environment. We should try to instill confidence and satisfaction in employees. We also have some private companies providing mental health support and counseling services to employees. That is what we should learn from. Once their voices are heard, employees will feel better, and then they will have their productivity increased. Employers have the responsibility to protect the mental health of employees, and in fact, we rely on the concerted efforts of our stakeholders. Everyone needs to work together in order to create a harmonious work environment. In turn, that will increase the productivity of companies and then the productivity of society. I so submit.
Dr. Tan Yue-hun. Thank you, President. Hong Kong is really fast-paced. Many of us are constantly under high pressure. We are really tense. It is very common to experience mental conditions. Some 27% of our employees experience symptoms of anxiety and also other mental health issues. The ratio is much higher than the global average of 16%. In our legislative framework, we have the Occupational Safety and Health Ordinance and the Employees Ordinance. These are related to the protection of employees' rights, but there are not much about the protection of employees' mental health. That's why I support the motion that the government should enact legislation to protect the mental health of employees and encourage corporates to adopt flexible work arrangements and mental health policies. We need to create a balanced, trusting, and safe workplace environment for employees. One, we need to review the existing legislative structure and find the gaps in our legislative frameworks. We should make reference to the overseas experience and add a compulsory mental health check under the OSH ordinance. For corporates which hire a large number of employees, they should be mandated to conduct a mental health checks for their employees every 2 years. Now, the employers must submit a plan to the Labor Department for improving workplace environment. In terms of employees' compensation, we need to review the ordinance so that psychiatric and mental health illnesses caused by work are items eligible for compensation. This will drive employers to improve the environment. And also we need to review the definition of disability under the Disability Discrimination Ordinance CAP 487. The lack of a mental health plan should be considered a kind of discrimination. Now, the government should charge a course forward for subsidizing the relevant corporations. Now, several years ago, the voluntary mental health workplace charter was launched together by the Labor Department and other departments. So far, some 700,000 employees have been covered by the mental health workplace charter, accounting for 20% of the employees. Now, as the largest employer in Hong Kong, the government should take the lead. Departments and subvented bodies should be mandated to sign the mental health workplace charter. We need to ensure that the employers are taking up their responsibilities. And we also need to provide systematic support for employers in the private sector so that they would invest in plans to protect employees' mental health. 3, we need to establish a digitalized platform for improving mental health through online screening as well as offline referral. We can improve mental health. Now, we should provide more free of charge clinical mental health services at family wellness centers and also other district health centers. Besides, the government should study a platform for providing real-time mental health assessment platform to provide immediate screening to employees, which also mobilize resources in the community and also the HA to provide more timely identification and referral services for people with mild symptoms. For moderate to serious cases, we should trace these cases and provide them help through the SOPCs. We need to implement the tripartite collaboration model to improve mental health as mentioned in the policy address. Thank you. Mr. Kenneth Lau. President, now Hong Kongers' lives are fast-paced and we focus a lot on efficiency. It imposes a lot of pressure in employees' mental health. Now, at least 1 in every 4 employees experience anxieties and depression symptoms because of work stress. The ratio is much higher than other places in the world. We really need to protect employees' mental health. The government must provide appropriate support services. The motion and the amendment proposed studying a legislation to protect employees' mental health and formulate standards for various industries and introduce the rights to disconnect outside of working hours. However, that would jeopardize the operating environment in Hong Kong and, in return, employees' welfare. So we need to encourage and provide incentives to corporates to improve the working environments and create an inclusive culture. That should be the first step. Undeniably, the government still has much room to improve in terms of improving mental health in workplace. Now, in 2019, the Mental Health Workplace Charter was launched. Private and public bodies are encouraged to offer seminars and talks to improve mental health and also create an inclusive and supportive environment for persons with mental issues. As at last year, there are 1,600 signatories covering some 700,000 employees. However, this is just a voluntary measure. As long as the participants sign the charter, they can be listed as a mental health friendly organization. But there is no ongoing assessment for the participants of the charter. The government needs to conduct a review and require regular review reports from the signatories. Corporates need to formulate an internal risk assessment plan and measures to help employees with mental issues with equal chance. Now, because of the lack of resources, many corporates are unable to provide in-house psychiatric services for their employees. So we should support SMEs in participating in the government's funding scheme. There should be a one-stop platform to help employees deal with stresses they encounter in work and in life to promote mental health. Now, studying the enactments of legislation to protect the mental health of employees, for example, allowing employees to claim for compensation for psychiatric injury arising from work, it would lead to more labor disputes and litigations. It is particularly difficult to define the employer's duty. In terms of legislations on regulating working hours and also right to disconnect, it may not be applicable to the context of Hong Kong. For example, multinational corporations need to communicate with their staff across time zones. They will have difficulties abiding with the rule. SMEs will need to invest more money to hire additional manpower, and it would hurt their competitiveness. Well, without a full recovery of our economy, these legislation may lead to wage cuts or even redundancy. Creation of a happy workplace is helpful for promoting employees' well-being as well as corporate development. That's why we need to give incentives to corporates and employers to improve the mental health of employees and create a supportive environment. Employees should also be encouraged to seek help and self-help. Legislative amendments would cause a rippling effect affecting labor relationship and also the competitiveness of Hong Kong as a whole. Now we need to create a win-win situation for both the employers and the employees. Thank you. Mr. Frank Yang. President, in recent times, our economy has developed rapidly and there is a lot of competition. Employees are constantly under pressure. This is a problem we need to face head-on. According to a survey, more than 1/4 of our employees experience mental health issues because of work. The ratio is much higher than the global average. In 2019, the Mental Health Workplace Charter was launched for voluntary participation by corporates. However, there is also a trend of stigmatization of mental health issues in society. Many employees choose to hide their symptoms because of stigmatizing effects, and they miss out the best opportunity to get treatment. It also leads to economic cost. Mental health issues lead to a loss of 14.9 billion Hong Kong dollars each year in lost productivity, additional costs in healthcare, and also loss of talents. This is just the tip of the iceberg. Long-term neglect of employees' mental health would hurt the stability of society. If you look at other places, in the UK, a law was enacted to mandate the employer's duty to protect employees' mental health. There is a tiered support system from prevention, education to rehabilitation and treatment. In Japan, corporates are mandated to conduct an annual stress checks, and there is strict rules regulating overwork hours to prevent the occurrence of karoshi or deaths from overwork. Now we need to use policies to direct resources and apportion responsibilities. In recent years, Hong Kong has implemented many innovative measures. For example, the pilot scheme on good mental health assessment is offered through DHCs, and cases would be referred through a tiered model. In 4 months' time, 10,000 Hong Kongers got help. It shows the great demand in community. There is also the Joyful as Healthy Workplace. There are workshops for relieving stress and also subsidies for corporates to purchase assessment services. In the community, there are many organizations providing mental health first aid training. Through mutual support between employees, we can identify high-risk cases early. Many large-scale corporations have adopted this model. To address mental health issue in workplace, the labor welfare cannot fight a lone battle. Other bureaus, especially the health bureau, should be involved. In order to improve mental health at workplace, we need to improve the policies, redirect resources, and create awareness in society. First, the voluntary measures must be made mandatory. Mental health assessment should become an item to report in the ESG report. And also, the tiered support model should be extended to the workplace. Resources under the DHCs and other NGOs should be integrated, and a one-stop platform should be created. Second, the government should consider extending the scope of Shall We Talk to encourage the participation of corporations in mental health first aid courses. Senior management should also be asked to join these courses. Now, through an innovative model, we should integrate mental health discussions in our work culture, but rather a risk or crisis tool. And also, we lack a database on the overall mental health situation in Hong Kong. With such a database, we can conduct analysis on the mental health status in various industries so that specific industries can implement targeted measures. Mental health of employees underpins our competitiveness. We can't just see our human resources as mere figures. We should give them dignity and improve their mental health. We need to realize a sustainable development with mental health, good mental health of employees. Thank you.
Professor Priscilla Leung. Thank you. I thank Mr. Ng for moving this motion so we have a chance to have a detailed discussion on mental health, which is a very important public health issue. I'm afraid I can only agree with part of the original motion and the amendment. As a result, I'm going to abstain. I come across a lot of students and friends suffering from some kind of mental illness. So 1/4 of the population suffer from anxiety and depression is true. There are insurance policies providing compensation for counseling and psychological consultation sessions. I think we can draw reference from this. Enterprises can also take out these policies. When it comes to legislation and the right to disconnect outside work hours, I have something to say. I was a CEO for 3 years. I was at one point an employee. I am an employer because I employ a group of people to help me with my council work. You have to identify the cause before you can get insurance coverage. That's something to do with causation. But sometimes, for some people, they are more vulnerable to stress because of their personality or because they play too much video games. So if you want to legislate to protect mental health, it's difficult because it's not easily quantified like physical injuries. Well, there are some celebrities all of a sudden choose to become a monk or commit suicide. Well, they have their own reasons, and different occupations have different stress levels. If you pursue a career, you need to take into account whether you are the kind of person that can take the related stress. Say, for example, our assistants or a legislator. So it's work related to the mental illness. It's a very complicated case. And if you legislate, then employers are afraid to approach employees outside working hours. But sometimes for very strong reasons, you need to approach your employee. Say, for a legislator or a district councillor, you will have to go to the district all of a sudden. If there is a rigid legislation, it's very difficult for us to manage. There are some people who are so dedicated to their work, they refuse to leave. Say those working on AI or some programming, say they are working on a formula, they are working on a program. So who decides whether they are working overtime, the employer or the employee? It's very difficult to differentiate. I think we should start with publicity and education. Employers should exercise discipline and restraint. I myself, as an employer, will hold certain dispatches. If it's outside work hours, I'll wait till the next day. I want to reduce the communication outside work hours, and when there is one, it means it's urgent. There are many incentives you can put in place in the private sector. Say, for example, you provide ownership of the share of the company to your employees. If you legislate that to prevent work overtime, then it's not ideal. This will undermine the development of enterprises, especially startups. That's why I'm afraid I can't support the original motion that is in relation to legislation and the amendment in relation to the right to disconnect. I so submit. Mr. Champula. Thank you. We've had 4 motions on mental health. It shows that this is a very important issue to the general public. More resources have been devoted to the mental health of students and employees. I think that resources should be devoted to employees to educate them so they realize the importance. There are surveys conducted saying that if the satisfaction of employers is good, then absenteeism will drop. There will be an enhanced productivity as well. An enhanced mental health status of employees will benefit the enterprise. Some people think that if you don't suffer from any mental illness, that means you have good mental health. That's not the case. Well, if you have good mental health, you become more resilient against stress. It's easier for you to tap into your potential. In work, employees have to handle interpersonal relationships, as well as their work. There is stress, and they all become triggers. Mr. Ng's original motion asked for legislation to protect mental health of employees. I have reservations. We are not like Australia, Taiwan, Korea, and Japan, that there is a legal framework clearly stating the responsibilities of employers. In New South Wales, in Australia, there is a law requiring employers to put in place measures to ensure mental health of employees that covers excessive workload, harassment, as well as bullying. The direction itself is something that I agree. I do agree that there should be timely review of the employees' compensation ordinance. But how can we find evidence to prove that in a particular case the psychological injury is directly related to the person's work? That's controversial. In Mr. Kwok's amendment, he also mentioned that psychological injury arising from work should be prescribed as a sedentary occupational disease carrying a reasonable level of compensation. I think that's controversy. Well, when it comes to occupational disease, there is only one cause, is any disease contracted as a result of an exposure to risk factors from work. When it comes to psychological injury or impairment, there may be many factors. It's very difficult to decide or prove that the psychological impairment comes from only work. However, I do think that it's the responsibility of employers to ensure that there is a healthy workplace. Employers should do more. They should care more about employees. They should handle work issues. They should enhance a sense of belonging of employees. A good employer-employee relationship is crucial. Regarding the mental health workplace charter, currently, as long as these workplaces tick certain boxes, then they can be given recognition. But are there actual indicators to gauge the effectiveness? There is no ongoing assessment of their effectiveness. I think that there should be an assessment on the effectiveness on the charter to ensure that they are effective. What employees themselves, they should pay attention to their own situation and find work balance if this will be conducive to maintaining their mental health. Mr. Chu Kwok. First declaration. I am the head of a subsidized primary school, and I'm also the chairperson of a teachers association. According to a survey conducted in 2023, it shows that the average score was a 4-3 of satisfaction among teachers. Close to 60% of teachers have a low morale. Half of the people suffer from anxiety and they feel depressed. And in 2022-23, a hotline received 440 requests for help, which is a huge increase. A few years ago, a teacher was subject to bullying. As a result, the teacher committed suicide. It's drawn a lot of attention. I would like to say that bullying at workplace is still quite rampant. Well, on top of bullying, there is excessive workload as well as uneven allocation of work. Teachers are scared to voice out because they don't want their assessment or the referral to be tarnished, because it makes it difficult for them to find another job. There's a case in which a teacher left work because of bullying. The school continued to smear the teacher, blaming the teacher for the poor performance of the school. The teacher lodged a complaint asking for compensation in the labor tribunal. The school reported to the police, which in turn put more stress on the teacher. We hear about these cases a lot. This shows that there is a loophole in the school-based management approach. There is room for improvement when it comes to reducing the stress of employees. teachers have a huge influence on the life of others. They are under tremendous stress. There are measures of the government to help teachers, but they are remedial in nature. There is one that seems like a preventative one, the Mental Health Workplace Charter, but the participation is on a voluntary basis. There are no indicators or no requirements, so it exists in name only. Some people may say that you can go to the social workers, but social workers are already snowed under with the workload from students. I say that counselors at schools should be a regular work post so that a better environment can be created at school. In the original motion, there is the mention of legislation to protect mental health of employees. There are other jurisdictions that have legislations saying that employees can ask for compensation if they suffer from mental health. And there is also a prescribed work hours. On top of that, there are also work guidelines. I think the government should draw reference from these approaches. I speak in support of the original motion and the amendment.
Mr. Tommy Joe. President, I would like to address a point in the amendments on working hours regimes and overtime compensation regimes to reduce situations of excessively long working hours and uncompensated overtime work, and the introduction of the right to disconnect outside working hours to ensure there is a work balance for employees. We have had similar contents circulated, repeated many times. With working hours, different industries have different working hours. Many years ago, labor unions promoted that security guards should have only 12-hour shifts. Instead, there should be 8-hour shifts. Everyone said that because they thought 8-hour shifts would mean for still 12 hours compensation. So security guards with that only earn $6,000 instead of the $9,000 they used to earn. And they can't help it but to get a part-time job because they can't cover their costs with the income. So now they're back to 12-hour shifts for security guards because there is a need for such long working hours for certain industries. If we have shorter working hours, it will exacerbate the manpower shortage problem. And many industries or many labor unions said that introduction of imported labor would actually make for more acute manpower shortage. The Liberal Party advocates for market-led measures, and we have different members representing different sectors. I myself represent the F&B sector. We have some chefs of dim sum restaurants. They will attend work early because they need to have the dim sum ready at, say, 6 or 7 in the morning for those who are coming to the restaurant to consume. In the retail sector, for different shops, there are different working hours. So what is said in the amendment with the right to disconnect outside working hours, the Liberal Party would say this: we respect the contracts set between employers and employees if they, when drawing up contracts, included the right to disconnect outside working hours. We would respect that. But then for many jobs in the city, we can't really implement that. For civil servants or electrical members even, there's really no right to disconnect outside working hours. We don't want to restrict the number of working hours. That would in turn hurt our competitiveness. We have seen advancements in communications technology. It is really hard to define what is work and what communication is. The Liberal Party does promote family-friendly employment policies so that more are willing to rejoin the labor force. And of course, we want them to achieve the dual roles for both their families and work. We have some labor union representatives repeatedly make demands. They're asking for offsetting of pension funds. They're also asking for the increase in minimum wage. And we only had increases, but with the minimum wage scheme, it actually can be the case that it can increase or decrease, but we have only had increases every year. There can be infinite possibilities with demands. If we look at what is happening in the US, why is it that to this day they are forcing factories to move back to move back to the US with tariffs? It's because the labor unions there force the businesses outside, and we really should learn from their experience. Thank you. Mr. Tang Fei. In 2023, the Education Workers Union conducted a survey, and it is said that many teachers face mental health issues, and 40% of them have anxiety. It shows that many teachers face mental health problems. This is not official diagnosis, but this is how teachers felt. And if teachers suffer bad mental health, as leaders of students, it is hard for teachers to counsel students. We often think about how students need to have motivation to learn. Why aren't we thinking that for teachers, that teachers should be motivated as well? Mr. Chu Kwo-keung, a principal of a primary school, has talked about how to relieve pressure for teachers. I will not repeat what he said. I think we can talk about the practices locally and overseas as well as in mainland. The mainland has a guiding opinion issued on protecting the mental health of teachers. And this in turn is followed in many different provinces and cities. They have some policies and some measurements for assessing the mental health of teachers. I think Hong Kong can follow suit. There are 3 major measures we can do. We need to provide professional support. We can refer to the HSE of UK's practices. They have a mechanism to monitor the pressure of teachers. There are 32 indicators in 7 categories. We do not need to be as detailed with our framework, but we can refer to the successful experience in other places. And the Education Bureau can work with tertiary institutions, say those studying psychology, to make an assessment for teachers so that we can intervene when we have identified those in need. We can have, say, emergency assistance for teachers. In fact, that is done in certain places where there will be intervention and someone will take over for the teachers if they are labeled as high risk. We also have, for another place, we have new teachers undergoing apprenticeships, essentially. In the EU, they would have a new teacher receiving counseling from a counselor, and that is also, the counselor is also a teacher sometimes, and they can receive both teaching and counseling support from the counseling teacher. And we also have various apprenticeships that would have specifically counseling services provided by counselors. In the US, they have a mutual aid mechanism. The teachers union in the US have a peer support network that would provide support to teachers. For example, in Chicago, they have a platform set up for mutual aid amongst teachers. We have many technologies in Hong Kong. Can we establish a similar platform to provide support to teachers to establish such a peer support network? Well, I think the most controversial thing is whether to enact legislation. We have in the European countries some legislation enacted, and that has increased the influence of teachers in school unions. In the US, however, in New York, they have specifically made a court ruling to protect the welfare of teachers. I'm not saying we must enact legislation. We have but seen many places that have offered mutual aid mechanism or various kinds of support for teachers. So can we have more diversified measures in Hong Kong as well? I so submit. Ms. Jovi Chen. Thank you, President. I speak in support of Mr. Stanley Ng's motion and Mr. KWOK Wai-keung's amendment. Hong Kongers face great pressure. Even when I was studying, I thought I was in great pressure. There was a hit clip back then, and there was a middle-aged man taking a bus who said, if you're facing pressure, I'm facing pressure as well. So it shows that Hong Kongers indeed face great pressure. Well, this was from a long time ago, so students these days haven't really watched the clip, I believe. When I was a student, I already faced great pressure, and when I started working, I understand that many those working face great pressure. We have 60% of people in the world who are working, and they spend much time at work. It's the same for Hong Kong. And protecting the mental health of employees is therefore important. The motion quoted a study saying that over a quarter of employees in Hong Kong have mental health issues such as anxiety and depression attributable to work pressure. I have some alarming figures to share with you that would demonstrate why those who are young aren't willing to work. Last year, the Youth Association of the FTU conducted surveys on youngsters. We have received 500 completed questionnaires. We are trying to understand the pressure they face. For those under 25 years old who have had 2 years of experience, 80% of them said that they face great pressure at work, saying that they don't want to work. 60% of them want to just resign. And we have many of those facing great pressure at work. They think they have mental health problems. We have 78% of them feeling that they are anxious. And according to our surveys, 75% of the respondents, the young respondents, said that they did not receive adequate support in their work. I hope the government can play a bigger role in providing support with them. And the motion has somewhat mentioned this. We also need to offer adequate protection to workers. We do not have enough protection in the Employees' Compensation Ordinance. If you have dealt with work injury cases, they often do not receive adequate compensation. Mr. Tang Fei talked about some European countries having legislation. In Japan, they actually have legislation on this as well. In Taiwan, they have also promulgated some guidelines. I think we need to move forward to keep pace with the times. We only have the LWB representative here, and I think the Health Bureau plays a part in this as well. The Mental Health Workplace Charter is jointly launched by the Labor Department and the Department of Health. And the WHO says there's no health without mental health. The primary healthcare blueprint should have more mental health related elements so that citizens can receive due support when needed. Last August, we had 3 district health centers launching mental health related services: Tuen Mun, Eastern District, and Yao Chim Wong. They have provided on a district level mental health assessments to citizens. If necessary, they will make referrals. But in December of last year, we have seen some figures. The services are quite popular. There are over 10,000 people who have participated in the services. But it seems that the further developments will only take place next year. Can we expedite the progress? Employers also play a role in this. They should attach great importance to protecting the mental health of employees. They should foster a mental health culture so that employees can have good work-life balance. And this will benefit not just the employees but also the employers. This will encourage more youngsters to join the workforce, retain talents, and that will also increase productivity. Unlike some members who have a business background, it's not either or. It's not a zero-sum game. I so submit speaking in support of the motion and amendment.
Professor Chow Man Kong, President, mental health is a societal and public healthcare issue we can't neglect. Employees spend more than 8 hours in the workplace. Mental health issue is something that needs to be addressed by the government, the employer, and also the employees. An article published by the WHO last year mentioned that more than 11% of employees in the world have contracted mental health diseases. It is estimated that some 120 million working days have been lost because of depression. The economic cost was $1 trillion. I agree with parts of the views mentioned in the motion and the amendments. I think that to improve protection for employees' mental health, spending money is not the most effective means. On the other hand, we need to use legislative measure to arrest undesirable work culture in workplace. Now, work stress is not the only factor leading to mental health issues, but at a workplace, whether there is sufficient communication between the employer and the employees, and the demand and expectation of employers, as well as whether there is a cause for relieving the pressure, are important. I suggest the government take the lead and incorporate rights to disconnect outside working hours into the employment contracts with new employees so that there can be an understanding right from the start. Besides, specific crises, for example, typhoons or social instability, outside of working hours, the employees should be allowed to disconnect from work. With the advancements of technologies, everyone has a smartphone. Many employers would expect employees to reply to their messages outside of working time. It would mean less personal time and family time and cause more work stress. Last year, Australia enacted the right to disconnect law. The punishment is harsh. Any breach would lead to a 300 to 400,000 Australian dollars punishment. Now, with the right to disconnect outside working hours, it is easier to define overtime works, but that is just the case of Australia. It does not apply to Hong Kong's context. We can't have too much regulations because that would add to the operating costs of SMEs, and if these businesses closed, then employees and employers will both become victims. Now, the government should take the lead in doing the following. On the employment contract, it can be specified that unless necessary, all work directions or messages related to work sent through social media platforms can be read on the following day. I also support imposing a harsher punishment on discrimination or harassment at workplace so that victims can make a stronger claim. According to the WHO, there are 4 types of workplace mental health issues, one of which is the discrimination. Now we have the Equal Opportunities Ordinance and the Disability Discrimination Ordinance. These also covers discrimination at workplace. However, verbal assault and also other less obvious attacks will also lead to psychiatric injury, and these are harder to claim for compensation. We need to improve the law to ensure that everyone can go to work happily and return to home also happily. Thank you. Dr. Lo Wai-keung. President, I thank Mr. Stanley NG for his motion and Mr. KWOK Wai-keung's amendment. Hong Kong has a very fast pace. According to the survey, a lot of employees experience work stress leading to insomnia, lack of concentration, and depressed mood. It shows that the issue of mental health at workplace is a concern, and we need to protect employees' mental health and provide resources to support the employees. The Department of Health, together with the Advisory Council on Mental Health, launched the Mental Health Workplace Charter in November 2019, encouraging local enterprises to establish a mental health-friendly workplace. As at December last year, there were 1,600 participating enterprises. We need to recognize the results of the Charter. However, in terms of studying enactments of legislation to protect the mental health of employees, we need to be more prudent. So far, there is not a set of universally accepted definition for mental health led by long working hours. There is no direct causal links between long working hours and emotional and psychiatric disorders. It explains why most countries and jurisdictions do not define mental health issues as an occupational disease. Now, our Employees' Compensation Ordinance only covers injury by accident at work. The claimant must prove that there is a direct causal link between the injury and the negligence of the employer. Now, mental health disorder have very complicated factors, for example, personal or family factors. If it is defined as an occupational disease, it would lead to a lot of disputes and enforcement difficulties. Mr. KWOK Wai-keung's amendments ask the government to formulate working hours regimes and overtime compensation regimes for different industries, and the introduction of the right to disconnect outside working hours. While I think it is out of touch with reality, it would affect the operation of various industries and hurt the business environment. I'm curious whether Mr. KWOK Wai-keung's office has implemented this so-called right to disconnect outside working hours. The BPA and I consider that any amendment to labor legislation would cause a rippling effect. There must be sufficient discussion in society, and also a consensus must be reached between the employers and the employees before a legislation can be enacted. Now, the strength of our recovery is underwhelming. The government is working closely with industries to find new growth points and create new momentum. Under this backdrop, any legislation that would cause unnecessary disputes and hurt labor relations, as well as the stability of society, should not be considered. That being said, we can't neglect the issues of mental health. For public and private bodies, manpower is the most valuable resources. To enhance productivity, we need the full commitments of employees. We can adopt 3 measures to ensure sustainable growth of enterprises. First, the government should provide more incentives to attract more public and private bodies to sign up for the Mental Health Workplace Charter so that they can become mental health friendly or outstanding mental health friendly workplaces. Also, we should make use of advanced technology like AI to enhance work efficiency so as to free up more time for employees to do creative work. The time saved can also be used to seek a balance between work and life. Also, public and private bodies should be incentivized to provide more mental health support. For example, more seminars, workshops, and hobby classes for employees. Psychological services should also be provided to employees to create an inclusive workplace. I so submit. Dr. Chow Siu-chung, President. First of all, I thank Mr. Stanley NG for his motion, which gives us an opportunity to debate on how to protect the mental health of employees. All employees are entitled to work in a safe and healthy workplace. Health can be physical and psychiatric and psychological. Overwork can undermine employees' mental health and set off mental illnesses. Work stress can come from, for example, unreasonably heavy workload, office bullying, or unduly long working hours. I will focus on the issue of working hours. Working hours has been an important topic of discussion. Now, since the establishment of the International Labour Organization 100 years ago, the first charter passed in 1919 in relation to working hours required governments to set a limit to the maximum working hours per week to address fatigue. Now, this provides a foundation for labor laws in many countries and lead to standardization of working hours. But this does not apply to Hong Kong. According to the ILO's survey, 30% of Hong Kong's employees work more than 49 hours per week. The ratio is much higher than 40% in Macau, 70% in Korea, 14% in the UK, and 13% in the US. Many of our works are famous for their long working hours. For example, security guards who need to work double shifts. They work 6 days a week, 72 hours per week. And also, the average working hours for the catering industry is more than 50 hours. There are a lot of surveys and studies in the world showing the links between long working hours and mental health deterioration. According to the WHO and the ILO, for those who work more than 55 hours per week compared with those who work below 35 hours a week, the risk of stroke is 35% higher, and also 17% more likely to die from ischemic heart diseases. Now, in 2021, more than 1,000 Chinese workers in Hong Kong were surveyed. It shows a relationship between long working hours and anxiety. For those who work more than 72 hours per week, the likelihood of anxiety is 6 times higher than those who work fewer than 36 hours per week. That is especially more so for female workers and older workers. Now, the effect of long working hours is real. Now, Mr. KWOK Wai-keung calls for formulating working hours regimes and overtime compensation regimes for different industries. We have had a long discussion on this since 2013, when the Standard Working Hours Committee was established, to the submission of the report in 2017. In 2018, the last term of the government announced that the plan would be set aside. On the other hand, working hours guidelines were set for 11 industries. Now, the government, employers, and employees failed to reach a consensus. That's why we still fail to standardize our working hours. I don't think the government is likely to review the policy on working hours in the near future. Taking this opportunity, I urge this term of the government to reconsider formulating working hours regimes. If you leave it to just the employers and the employees, we will not reach a consensus in another decade. Regulating working hours is a powerful tool to improve mental health of employees. Most countries and places in the world have legislated to regulate working hours. If the government has the will, you can definitely do it. I so submit.
Ms. Doreen Kong, I thank Mr. Stanley Ng for moving the motion. In 2023, the government launched 10 support measures on mental health. That includes priority given to urgent cases, enhancement of the waiting time, and a number of other measures. The Council of Mental Health has launched a number of measures. They've been effective. I really appreciate that. These measures have a positive impact on protection of mental health. But over a longer term, it seems that is no longer effective. A lot of these measures are quite passive. Say, someone suffering from depression is unlikely to seek help on their own initiatives. We need to strengthen preventive measures. We have the OSH ordinance requiring employers to put in place a healthy workplace. Employees' compensation ordinance may apply to mental injuries, but you have to provide proof. The employer may have to provide a safe workplace, but prevention of mental illness is not mandatory. In the UK, there is a requirement that employers will have to put in place flexible measures to reduce stress. Otherwise, it amounts to discrimination. Discrimination ordinance also covers mental illness, but proof is required. It's difficult to prove their case. In November 2019, the Mental Health Workplace Charter was put in place. It encourages employers to create a healthy workplace. Compared to the UK requirement of insurance coverage, it seems that there is not much assessment of the effectiveness of our charter. 60% of youngsters don't know whether their employers have signed up to the charter. Some employers said that they don't know about the charter. Seems there is huge room for improvement. A month ago, in Singapore, there was a legislation to ensure a fair workplace. It was endorsed. Mental health was part of it. When it comes to recruitment, dismissal, decisions, that there should not be any discrimination against employees. This ensures employees' rights. Mr. KWOK made some proposals in his amendment, say, for example, the right to disconnect outside work. I have some reservations. Legislation to protect mental health needs time. There should be rational discussion, and there should be a consensus forged. The approach should be graduate. It should not be rushed. Mental health is not just an issue for employees. Is one for the entire society. Well, if there is legislation, there should be clear responsibility set out for employers. It takes time. There should be a proper framework put in place. Well, when it comes to measuring the advancement of a society, it should be comprehensive. The sense of happiness should be reflected from the state of mental health of the population. Ms. Lillian Kwok, I thank Mr. Ng for moving the motion. WTO says that health also includes mental health. So we need to ensure mental health of the population. But the situation in Hong Kong is worrying. We've heard spate of incidents of suicide. There are studies saying that 61% of adults suffer from some kind of mental problems. The incidence rate of Hong Kong people is 2.5 times the average of the world. We have a fast pace of lifestyle. 40% of Hong Kong employees work overtime. The stress to work when you work in Hong Kong is tremendous. In 2019, there was the Mental Health Workplace Charter. Well, the measures should be enhanced as well. The Californian government launched measures to guide employers, asking employers to be mindful of the issue. In Australia, there is an organization set up to provide guidance on mental health assessment. A lot of enterprises express concern about mental health of their employees. They have measures in place to relieve stress. Well, in Google, there is a 20% of chill time. And there are enterprises providing massage chairs or measures to ensure work-life balance. In Hong Kong, some enterprises procure foot massage treatment from social enterprises. There are many different ways to relieve stress for employees. I think the government should continue to enhance the charter. This more comprehensive guidelines should be put in place. An organization can be set up to guide enterprises as well. But one's own constitution is important. You need to build up your resilience. Children should be trained to build up their resilience from a young age so that they can withstand stress from academic performance and that from the workplace. The Education Bureau from 2004 started a measure. But they only select certain students to conduct assessments. Not everyone's covered. My suggestion is that there should be a bigger coverage to teach students to build up the resilience. In Finland, they have done some good work. There is a World Failure Day. On that day, students share their experience of failing something. This, in turn, will build up their resilience to face challenges. In Hong Kong and in the mainland, there are schools that arrange for military training or boot camps for students to train them up in different areas. I think we can draw reference from these approaches. Mental health of employees is related to our economic performance. Studies show that in UK and Japan, mental health issues caused economic loss of $500 billion and $430 billion. In Hong Kong, the loss was about $60 billion. In the UK, there is a plan to ensure mental health. And there is a calculation made. For every pound, there is a 59% return. So resources devoted to ensure mental health will protect economic benefit as well. In Hong Kong, we have round-the-clock counseling hotline. We have stepped care model. And all these are there to prevent cases from worsening. I ask the government to continue with their efforts. Mr. Kingsley Wong. I speak in support of Mr. Stanley Ng's motion and Mr. KWOK's amendment. Studies show that over 27% of Hong Kong employees suffer from anxiety and depression. This is higher than the world average of 16%. The average score of mental health is 47.6%, which is lower than the 50 pass mark. That's consecutive for 5 years. Unreasonable work, unreasonably long hours is one of the reasons. WHO says that if work hours is longer than 48 hours, it will increase the risk. But a large number of people, that is 36% of employees work over 48 hours, and 8.1% of people work over 60 hours. 85% of employees suffer from some kind of illness, say depression, loss of appetite, loss of sleep, as a result of long working hours. In some places, there may be a time off in lieu or overtime compensation. Nowadays, the work pattern is different. You have your work phone, you're expected to answer questions from customers, from your employees, or have online meetings. That goes beyond the need from urgency. About 65% of respondents said that they still have to reply to messages from employers after work. They have to work online as part of their overtime. It seriously harmed their work-life balance. But there is no statutory compensation for working overtime. A lot of people are under stress continuously. There is no time for them to rest. How can they be healthy mentally? In the past, I have asked the government to draw reference from the mainland. If the time of an employee, if the off-work time of an employee is used for work, then there should be compensation. I think the government should start from the civil service. If you work online after work, then you will be given time off or overtime compensation. Unreasonable request is another issue. Well, sometimes we hear that if you offer $100 per hour, you won't get an employee. But employees told me that they are overworked because they have to cover the work of 2 or 3 other people. They don't want to go to work. Human beings are not robots. Reasonable work intensity is equally important. So employers should make sure that there is sufficient manpower to cover the service. In this way, then they can make money, and both employers and employees will be happy. Signing up to the Mental Health Workplace Charter will create a good environment, but the charter itself is not binding. It doesn't tackle work intensity and long work hours. A lot of employees in certain sectors, say lift repairmen and bus operators, sacrifice their time with family to work overtime because they need the overtime compensation to make ends meet. Some demanding positions are filled because people need to make a living. So whilst legislating for standard working hours, there should be a reasonable remuneration guaranteed so that when you work hard, you will be properly compensated so that you will have a good life.
Mr. Chen Yong. Thank you, President. Thank you, Mr. Sun, for attending the meeting. I thank Mr. Stanley also for proposing the motion. Mental health is important for the living of the people, and President Xi said many times we need to make sure the people are satisfied and are happy, and we should try to enhance satisfaction at work as well. Along this line of thought, as society develops, more people attach importance to mental health. When I was studying social work, a professor asked us who was suffering from mental health problems. No one raised their hands, but they said if someone is anxious, one is already suffering from mental health issues. So I hope that there can be greater awareness. I have heard other electrical members said that when we had much filibustering, some members said that during the small hours in their beds they heard the bell ringing as well. And we have those saying that it is time to go there and the bell is ringing. Some couldn't hear it. It's another form of mental health issue. We need to adjust, of course. And when the bell was ringing for 5 minutes, I saw some members looking anxious. And I guess we should make sure we are looking at our mental health as well. Why are so many people concerned about the mental health situation in Hong Kong? It is because we are living at a very fast pace at the moment, but with a longer lifespan, it seems that we are doing something right. We are helping each other. We are traveling during holidays. These have helped alleviate pressure on us. And let me show you some figures. We have 41% of workers in the world saying that they face pressure. And in Hong Kong, the percentage is higher. It's 49%. So the situation, to a certain extent, warrants concern. I think in the workplace we can help each other. We can go out to have meals. When there is great pressure, we can talk to each other. We can shoulder someone else's workload for the time being. When someone is not doing so well, when someone has a cold or a flu, it is easy for you to talk about it. But when someone has mental health issues, they may find it difficult to tell people that they have such issues because they are afraid of stigma. I think we need to have a better understanding of what employees are facing. There are services offered by clinics. There are also some counseling services offered by the social welfare department. I hope more people can take advantage of such services. If we talk about long working hours, it's not limited to Hong Kong. It is happening in many different countries. If we look at Xiaohongshu recently, some of those in the US say they have to work 2 jobs to maintain their living. It is another form of pressure. So I have some suggestions here for employers and employees. They should communicate more. They can brainstorm ideas together to create a better environment that would facilitate better mental health. We need to have more internal management. We can have company trips, for example. And in terms of regulation and government support, government can provide more financial assistance. We should also enhance public awareness on mental health, and we can maybe show some Stephen Chow movies. Watching that alone may have already alleviated pressure on them, and we can encourage employees to talk to their families and seek help from their families and relatives. We should maintain mental health just like we maintain our health to make sure we are able to make contributions to society. Thank you. Mr. Lu Chung-hung. I speak in support of Mr. Stanley Ng's motion and Mr. KWOK Wai-keung's amendments. Everyone faces pressure. Sometimes pressure can be motivating, but then too much pressure can take a toll on one's mental health. We must take note of this issue. Everyone has different sources of stress. For workers, one of the pressure sources would be long working hours. Different members quoted different figures saying that long working hours would cause an adverse impact on health. But then we never really took the issue seriously. We had employees choose different occupations. We have different occupations having different hours, and it seems that there's always a different justification. In the previous term, in the term of the government back in 2013 to 2017, we have talked about implementing a working hours regime, but that never actually took forward. I think now with the development of AI, we have an opportunity, but then we are also facing challenges. It's not just about AI. Before the advent of AI, we had some jobs that have a lower pay, that would have longer working hours for those to earn enough to cover the relevant costs. In fact, drivers at airports face the same problem. We are also moving towards a knowledge-based economy. We have those working in banking, design, and IT, etc. They are responsible for their own performance. As long as they complete the projects, they would have indicators set by their supervisors, but they just have to work on the projects on their own. And if they work more, they earn more. But this is a form of exertion of control by employers on employees. So employees practice self-exploitation in a way that they think they need to work overtime. If they don't work overtime, they will feel guilty. They will feel pressured. This is vicious competition. It is detrimental to health. It is toxic work culture. We really need to pay attention to this issue. Now with AI can replace jobs. People are now worried that they may get fired. Now some company may say that they will only need 5 people with the use of AI, and they will fire the 5 remaining people. And everyone is now competing for the jobs that will remain. So that will cause for vicious competition. But then we have seen AI increasing productivity. With AI, we can do a job that would normally take 10 hours to complete, now taking only 7 hours to complete. But with this, we shouldn't fire people. We should have people be more creative or enhance the quality of the products and services they provide. On this topic, we have heard differing opinions. I would say this on working hour regimes. It's not a form of regulation. Can we talk more about having a work-life balance? We have the government, the employers, the employees work together, brainstorm some ideas to make use of technologies or innovative concepts to increase productivity while decreasing overtime. Would that be possible? Or for the promotion of work-life balance, we can talk about its advantages. It would increase productivity. It would enhance the sense of belonging of the people. In turn, that should boost consumption because people are happier, and that will boost the economy. The government must take the lead in resolving a problem. You shouldn't think about it as a dichotomy with employees' interests and the development of the economy. If we enhance people's sense of happiness, it would be through improvement of work-life balance. It would resolve the pressure problem faced by others. We need to rest in order to work. Your time is up, Dr. So Chen-Wing. Thank you, President. Hong Kong has all along been a highly efficient economy. Not only in work, in living, we have a fast pace. When faced with environmental pressure, we have poor mental health. This is a persistent issue. According to a recent survey, 27% of the respondents said they have mental health issues arising from work. That is higher than the world average of 16%. This is something that we should try to resolve. And we should rely on the concerted efforts of different sectors to tackle this issue. I thank Mr. Stanley for proposing the motion to facilitate discussions in this area. I support protecting the mental health of employees, but with enacting legislation, I think we should be more prudent. Because for enacting legislation, there are no clear boundaries and definitions for the related areas, and we need to be clear in legislation in order to make sure we are working for the benefits of society. If we enact legislation to protect the mental health of employees, any form of legislation need to take into account various factors, as I mentioned in the following. One, we should not impede the development of the economy. And we need clear regulatory framework. If we do not have certainty in regulation, it will hurt companies' performance. We need to make sure there won't be additional costs on companies. We need to, in particular, consider whether SMEs can accept that. If there is over-compliance resulting in a compliance burden for SMEs, it will cause an even greater pressure, not only on the SMEs, but also the employees. 3, we need to be fair to all stakeholders, and we need to make sure the measures are practicable. There are different reasons why employees are suffering from poor mental health. It is hard to make adequate assessments. We need to clearly delineate the responsibilities of different parties to prevent abuse of power or potential disputes from arising. Enacting legislation would take time. Before we have the right timing, when we know the pros are clearly outweighing the cons. I do support what Mr. Stanley said about providing support services. The government should ride on the trend of protecting the mental health of employees and tackle the root cause of the issue and promote a work-life balance and family-friendly employment policies. The government may provide financial assistance to companies to hold training and enhance communication with employees and identify early on employees in need. And this is a responsibility of employers. We should enhance awareness of employers to provide targeted assistance. And we should also have targeted policies for the different goals we have. We need to teach the public also that they should seek assistance as early as possible. We should also enhance data collection and early intervention by social workers. Most importantly, the government must cast a social welfare net wider so that those in need can receive assistance. Thank you.
Mr. Chan Siu-hong. Thank you, President. I'm grateful for Mr. Stanley Ng's motion that is protecting the mental health of employees. According to the Secretariat, 27% of Hong Kong's employees experience mental health issues related to work, for example, work stress, anxiety, and depression. It is believed that they are caused by overlong working hours and work stress that is higher than the 16% average in the world. Some say that pressure will lead to better performance because in face of stress, adrenaline would be released to prepare us for the challenge. However, when we are constantly under stress, excessive adrenaline will lead to anxiety and nervousness, affecting the immunity of employees, leading to skin problems or even depression. I agree that we need to apply certain safeguards for employees' mental health. Without mental health, there is no health. So far, our OSH ordinance stipulates that as reasonably practicable, employers must protect the health and safety of the employees they employ. Now, the employees' compensation ordinance covers injury or death by accident arising out of in the course of employment. Only specified diseases would be eligible for a claim, but it doesn't include mental illnesses, unless the employee can prove that the mental health issue is caused by an accident at work. Otherwise, there would be no compensation. So I think we need to conduct a review on the relevant laws and study in a prudent manner whether we need to legislate to further protect employees' mental health. Now, the Voluntary Mental Health Workplace Charter launched in 2019 encouraged local enterprises to create a mental health-friendly workplace. Besides promoting the charter, the government should also encourage enterprises to conduct annual health or stress checks on their employees. More promotional and educational campaigns should be launched to help corporates understand that employees' mental health is the company's asset. Concerning Mr. KWOK Wai-keung's proposal to categorize mental impairments arising from work as a statutory occupational disease, in reality, it is difficult. According to the International Labour Organization, it means that diseases with a direct causal link with risk factors at work, and that these risk factors are obviously the causes of the disease. Now, there must be a very strong causal link between the work environment and the risk factors with the disease. For example, pneumoconiosis caused by dust and also jobs requiring repetitive motions leading to injuries of the arm. There is not a universally agreed standard and a universal agreement of unduly long working hours leading to mental distress. Mental distress or mental disorder may be caused by a person's upbringing, family conditions, personal traits, as well as other complicated factors. We cannot draw a direct link between mental health issues and work stress. Concerning right to disengage, some 20 countries have legislated for the right to disconnect outside working hours, but this is not applicable to many industries. As an international metropolitan, many employees have to communicate with their colleagues in other countries across time zones. Employees in certain jobs need to be on standby, and they cannot disconnect outside of work. It depends on the communication between employers and employees. I support the idea of work-life balance, but need to be realistic. We shouldn't follow other jurisdictions' practice carelessly. Our strength is in our flexible response. Flexibly working overtime is one of our key strengths. Thank you. Mr. Peter Shield. President, Mr. Stanley Ng's motion is about protecting the mental health of employees. He says that 1/4 of our employees experience work stress leading to mental health issues like depression and anxiety. Several days ago, I had lunch with my friends who are also in the business sector. I told them about the motion, and the bosses told me that they are all experiencing mental stress, especially with the difficult environments nowadays in Hong Kong. Everyone is depressed. This is not just an issue unique to employees. It is a universal issue for all Hong Kongers. In terms of relieving the stress and also support measures from the government, I fully agree. But we need to tread carefully in terms of legislation. Just now, I met with another group of business representatives upstairs just now. I told them about the upcoming motion. The dozen of them told me to convey to the president that they are all experiencing a lot of stress, and we all had a good laugh. They heard that, and when they heard that the motion called for compensation for mental health, they were dumbfounded. How can you compensate for mental health issues? There are usually other reasons, like family problems, financial problems at home, or relationship problem. How can you make a fair compensation? It is unrealistic, according to my friends. In terms of work stress or even bullying at workplace faced by employees, first of all, if you are bullied, tell your boss or your supervisor, ask them to intervene. If they fail to do so, or even if they are the culprit, change your job. Don't stay there and suffer the bullying. Second, stress. If you think you can't handle the job that you are in, well, actually, we have a very low unemployment rate, and I think it is not that difficult to change your job. If you think you can't handle, change your job. Mr. KWOK Wai-keung mentioned about formulating working hours regime and overtime compensation regimes for different industries. Also, studying the introduction of the right to disconnect. Now, overtime work after work hours are financially compensated for. So what's there to discuss? But this is very difficult to set a specific working hours regime for specific industries. The work types are different, and companies vary. Working hours for full-time and part-time employees, a company would have difficulty dealing with this internally, not to mention legislate for an across-the-board regulation. In terms of rights to disconnect, it depends on the employee. Some told me that don't call me after work. Some told me they would be happy to receive my call after work. Now, I had an assistant who was a sub-degree graduate. Now, he always told me he would like to have a pay rise. After several years, there is a job opening in my party with a 50 to 60% pay rise. That was actually his supervisory position. I told him, now if you take this offer, expect to be called over the weekends because you need to handle emergencies from the community. He told me he would think about it. On Monday, he told me he would give the offer a pass. Well, if you want a higher pay, you need to make some sacrifices. If you are a reception desk worker, I wouldn't call you after work. If you are a restaurant worker, I wouldn't call you after work. For other jobs that required overtime working, you would be compensated. You can accept it or you can you can choose not to accept it, but I don't agree with the legislation to deal with it. Dr. David Lam, President, there is a clear definition for emotional and mental disease, but mental health and mental condition has a very blurred line. Now, if the supervisors are grumpy and flippant, they would cause stress to employees. If employees laugh at each other's accents or their sexual orientation, the bullying would lead to extreme depression, anxiety, or even suicide. And these symptoms and these outcomes are easy to identify. However, emotional response varies from person to person. For those who are patients themselves, they would be more easily triggered, and they would lack confidence. Any comments from the supervisors would be interpreted as bullying. Now, if the legislation is too harsh, it would limit the choice of the employers and also affect the employment opportunities for those with a mental or emotional condition. We need to understand that some jobs are inherently stressful. For example, police, fire services, teachers, healthcare professionals. They are constantly under stress. Teachers are stressful. They're burdened with workload in classes. After classes, they still have to work. Similarly, doctors have to treat critical patients from car accidents and other accidents. They are very stressful in the AE&D, and they can't turn off their pages after work. Teachers need to deal with parents. Doctors need to deal with patients and their family members. They may be misunderstood and receive complaints. That is part of the job. Realistically speaking, those who can't cope with stress cannot handle these jobs. When there is a manpower shortage, employees are collaborating with their employers to tide out the difficult times, but employers have the responsibilities to provide training and support to employees. We shouldn't focus on prevention of stress. We need to focus on support and helping them to cope. We need to consider the nature of the job, and we can't always blame the supervisors or the employers on mental health issues or employees. Now, let me give you an example. Now, one personality disorder is too narcissistic and focus on self-interest and treat all comments and accusations as an attack on the person themselves. It would affect the emotional balance and the work life and the performance at work. A poor appraisal would lead to a strong emotional response from such an employee. But does that count as psychiatric injury resulting from work? Now, the goal is to encourage and guide these employees to enjoy work and life. If there is a piece of legislation that resulting in that employers are reluctant to correct the employees' behaviors, it would hurt various industries and even professions in Hong Kong. Of course, I support protecting the mental health of employees. I was just acting as the devil's advocate. Thank you.
Mr. Edmund Wong. Well, it's well known that the Hong Kong people face tremendous stress. There is a survey saying that a quarter of our population suffer from anxiety and depression. Last year, together with MWYO, conducted a study on the mental health of youngsters. We have surveyed 400 youngsters between the age of 18 and 29. We asked them questions about their behavior, about their source of information and other areas. And it's found that about 30% of respondents suffer from anxiety and depression. over 15% of them suffer the problems in a serious way. The source of the problem is overloading of work, familial problems, and interpersonal problems. We conducted this survey trying to understand the situation of youngsters, especially those who are working. We want to understand what they need, what their problems are, so that we can come up with solutions. These solutions include encouraging working youngsters to pay attention to their mental health needs and those of others, to encourage one another, and to assist employers to create a workplace that is friendly to a healthy mental health. So this motion of Mr. Ng echoes what I advocate. We need to protect the mental health of employees. This will get them motivated, which is conducive to work efficiency and productivity. In Mr. Ng's motion, there is a mention that the government should be urged to study enacting legislation to protect mental health of employees and adopt proactive measures to provide support services. I understand where he comes from, but the study should be in-depth and broad. We need to get an accurate understanding of the mental health profile of Hong Kong workers, and we also need to identify the real source of mental stress. Is it because of the nature of the work? Is it because of their personality? Is it because of a lack of interpersonal skills? Is there a lack of communications? If we cannot use a scientific and accurate study to work as the basis of legislation, then we will not be able to effectively tackle the problem. It will distort the labor market, giving rise to a number of other problems. In the end, we will be unable to protect mental health of employees. There will be controversies and disputes, which puts more stress on employees. I so submit. Mr. Tenkapil. I was listening to what Mr. Edmund Wong said. He's done a study. Regardless of the background of members, I think we all agree on protecting the mental health of employees. It doesn't matter how we do it. Some members express reservations towards legislation. When it comes to legislating for labor matters, then we need to spend on conducting studies, having discussions, and forging consensus. However, we need a starting point. I thank Mr. Chen Xiu-hung for his speech. Among the different options, he at least agree with one, that is Schedule 2 of the Employees' Compensation Ordinance, the definition of occupational disease. Well, if it's an injury to the psychological aspect of your person, and if it is listed in Schedule 2, then it should be protected. We need to have a mechanism in place to be able to pinpoint the relationship between psychiatric injury and work. I asked the Secretary to at least take the starting step. That is to start with reviewing Schedule 2 of the Employees' Compensation Ordinance. and whether we need to be more specific, say for example, covering depression and anxiety. We need to have more studies. We need to have support from scientific research. Also, we need to know whether the occupational health clinic have dealt with cases in which cases of these illnesses. There is a hotline that works round the clock, 18111. Perhaps something more can be done. Set up a new hotline together with the Labour Department and other departments, or add a message to the hotline telling employees that if they are suffering from psychological problems, then call. Sometimes it's a case of trembling, shaking, anxiety, depression. Employees don't want to seek help because they don't want to be stigmatized. They don't want to lose their job. We need to build up cases, and we need to collect information to build evidence, where some people don't want to hear about standard working hours and the right to be disconnected. But we are an advanced economy. We should not ignore these. In Shenzhen, enterprises use AI to carry out repetitive work, say, for example, clerical work. I think a productive employee will be one that is creative. Well, you need to give employees a stress-free environment so that they can make use of their creativity. I don't think we can avoid this issue. Mr. Lo Wai-keung asks if Mr. KWOK Wai-keung gives the right to be disconnected. Well, in my office, that's the case. When I call my employees who are millennials in the evening, they just simply hang up on me. But what's most important is that they deliver what they're asked to do. The new generation has a different attitude towards work and life, so we need to make changes as well. Mr. Portet, we've heard from over 20 members, so there is very little left to say, but I'd like to supplement. When it comes to legislation, Mr. Stanley NG talks about studying on legislation. You need support from people. Well, Hong Kong's suffering from economic difficulties and challenges. Employers and enterprises are having a hard time. We see an increasing number of defaults when it comes to loan repayment. And with the Sino-US conflicts, Hong Kong is caught in between. Well, the U.S. is having a huge round of layoffs. It seems that the consulate in Hong Kong is affected as well. When it comes to Hong Kong, we have 2019, we have the epidemic. We suffer from a great illness, and now we're trying to recovering. Some members talked about the use of AI, but is it a blessing or not? In the future, maybe stress doesn't come from working long hours, but from not having any work to do. This may not be a good time for an overhaul of the mechanism in Hong Kong. Whatever we do, whether to legislate or not, there are things we need to consider. A number of members talk about protections on different aspects. Mr. Bill Tang talked about Schedule 2 of the Employees' Compensation Ordinance. Well, if you want to sue your employer, you don't need to rely on this ordinance. under the common law system, if the employer doesn't provide a safe workplace for employees, then it may be a case of negligence, and you can make a claim against your employer. Well, you have to prove duty of care, and Ms. Priscilla Leung talks about foreseeability. So it's not a guaranteed success. In Hong Kong, we're still waiting for a definitive case that the court can follow. In the UK, there are 2 cases. In 1974, there is Health and Safety at Work Act, which clearly states that under certain circumstances, it constitutes an offense when the employer does not create a safe workplace for employees. And if an employee keeps calling in sick, and when there are symptoms, but the employer does not take action, that will be a problem. And there is the Employment Rights Act 19. In a later date, there is this constructive dismissal. If the employee is absent for quite some time without without lodging a resignation, and if there is evidence, the employee may claim compensation. Well, there may be some limitations as well. Say, for example, the line of 48 hours. But we need to consider Hong Kong's situation. Is it the right time to greatly change our employment system? If we are to try anything out, of course, I support the government's effort to put in place more support and education. But the time now is difficult. Peter Shield talks about pressure faced by employers, which is bigger than that of employees. Is it the right time to make big changes? I have reservations. We need to understand that it's not the time to make any changes that result in more pressure. It's not good for our recovery. We are required by our country to innovate. When I think an employee, whether it's one in the SME or large corporation, they will be required to do more, so there's no need to give them more pressure.
Mr. Dennis Leung, I speak in support of Mr. Stanley Ng's motion and Mr. KWOK Wai-keung's amendments. During the debate just now, some business sector representatives expressed concern, saying that members representing the labor sector are often making demands on workers' interests. But let me say this, for the motion on protecting the mental health employees, we are raising this motion because we receive feedback from workers. And we want the government, the general public, as well as other electrical members to pay attention to this issue. Since I became an electrical member, I have received a case that deserves sympathy. A primary school teacher told me that they were bullied. So they were suffering from depression, and they had to take a break from work to take a rest and heal their mental health issues. But they may not be entitled to sick leave, nor will they get compensation even if they are allowed to take sick leave. They need to take, say, vacation leave in order to get some treatment. And let me say this. Someone I know who was pregnant, for a pregnant woman, there should be special arrangements at their work so that they wouldn't have to work outdoors. But the employer did not do this. The supervisor didn't do anything either. Instead, she was asked to work outdoors and she suffered a miscarriage. Unfortunately, that was the experience that she got. Later on, in her work, she had to transfer to another post. The boss who bullied her before became her boss again, and she suffered even greater mental health issues. The employer did not take note of the situation, nor did they compile any records to prevent similar occurrences. After I started handling the case, I talked to the employer so that she wouldn't be subject to bullying again, worsening her mental health. We have seen this happen time and again. For an employee, work is something that is for life. If we have issues at work and the society has nothing to support them, if we do not have occupational diseases, including mental health illnesses, in legislation, how can we say that we are a metropolis when we are not offering adequate protection for employees to protect their mental health? I urge that we attach greater importance to protecting the mental health of employees so that we have a safe working environment for employees. We should also provide more support and sympathy to employees so that they can make contributions at their work and that they can recover from their mental health issues. I urge the government to attach importance to the issue, and the government should take a lead, and then the private companies will likely follow suit to offer more protection to employees. I so submit. Does any other member wish to speak? Mr. Stanley NG, you may now speak on the amendment. President, first of all, I would like to thank 31 members for expressing their views on the motion. Most of the members support the motion. There is a minority of members had reservations on enacting legislation to protect the mental health of employees. The Secretary said that the OSH legislation did offer protection to employees, but it did not protect the mental health of employees. We do not support this policy direction. I thank Mr. KWOK Wai-keung for proposing amendments. His amendments are in line with the motion, and it fleshes out the motion to reflect better the FTU's stance. I would like to specifically address points 2 and 3 of Mr. KWOK Wai-keung's amendments. I think we should expeditiously formulate working hour regimes and overtime compensation regimes. Back in the industrialization era, the goal was to increase productivity, and workers were just cogs in a machine, and they have equated working hours with productivity. Workers had to work long hours to get paid, but with advancements in technology and exponential increase in productivity, we have still employees working long hours and they are working overtime without compensation. According to electrical survey in 2023, we have 27.9% full-time workers work for 48 to 59 hours per week. 88.1% work for 60 hours or above in a week. And according to the WHO and ILO's studies, if one works for over 55 hours in a week, it will increase the risk of stroke or cardiac diseases. If we have to sacrifice healthful work, it is not worth it. I think society has to jump out of its current mindset. We shouldn't equate long working hours with productivity. We need to understand the importance of mental health of employees because it can directly relate to productivity and society as a whole. We need to make sure there is a win-win for all and that there is harmony in the employer and employee relationship. I also understand that women face mental stress. Therefore, I agree that there should be more mental health support measures introduced to target women with dual roles. Women with dual roles face great pressure. It is about them being exhausted from work. They are also faced with restrictions of stereotypes. They are regarded as carers. Even if they work, they are expected to make significant contributions in their families as carers. We need to change the public's mindset so that the caring role should not only be undertaken by women. There should be proper allocation of the burden among both genders so that women can also realize their dreams in their workplaces. I welcome the LWB in being proactive in responding to our motion, but I hope that they will also enact legislation to do more in policies. I so submit.
Secretary for Labour and Welfare, President, once again I thank Mr. Stanley NG for his motion and Mr. KWOK Wai-keung for his amendment. Altogether, 32 members have spoken on the motion. I thank you all. According to the definition of the World Health Organization, health is defined as a state of complete physical, mental, and social well-being, not merely the absence of disease. Mental health is a state of well-being in which an individual is able to make full use of his or her abilities, cope with the stresses in life, meet the needs of family and work, and contribute to society. Mental health is essential to the well-being of the individual, the family, and the community as a whole. The government attaches great importance to the mental health of the public, including the working population. We provide multidisciplinary, cross-sectoral, and holistic mental health services at various levels through the HA and other departments. We also provide community support through coordination among departments, including promotion, prevention, and early identification, as well as timely intervention and treatment and rehabilitation services to those in need, so as to safeguard and enhance the mental health of the general public. These services include promotion, prevention, and early identification for the working population, providing a safeguard for them. There is an additional protection for the mental health of employees. As I said in my opening speech, the Occupational Safety and Health Ordinance requires employers to ensure, as far as reasonably practicable, the safety and health, including mental health, of their employees at work. Employers are required to take appropriate measures to avoid excessive stress at work, which may jeopardize the mental health of their employees. Employees are also required to take care of the safety and health, including mental health of other employees in their workplace as far as reasonably practicable. To enhance the awareness and ability of employers and employees in dealing with work stress and mental health problems, and to assist them in discharging their responsibilities in protecting mental health of employees under the law, the Labour Department and the OSH Council organize talks and publicity events on work stress and mental health. At the same time, they also compiled information publications on managing work stress, which provide practical ways to deal with work stress and prevent mental health problems at both individual and organizational levels. The CSB and some enterprises also provide relevant training and support to their staff, such as organizing talks and seminars related to mental health, encouraging a harmonious and inclusive workplace culture, and promoting the development of a mentally healthy and friendly working environment to enhance the mental health of employees. The Labour Department, together with the Departments of Health and the Occupational Safety and Health Council, has been co-organizing the Joyful at Healthy Workplace program for many years to encourage employers and employees to work together to create a good working environment and advocate healthy diets, physical activity, and mental stress management. Like many members said, a lot of mental health issues may be relieved through meeting with friends. At the same time, to further enhance the awareness of employers and employees on mental health, starting from 2020, the Labour Department has cooperated with employers and employees to implement the Mental Health Workplace Charter. Organizations will be provided with professional support and information on teaching materials and community resources on mental health. They will also be required to promote mental health in workplace, facilitate early identification and timely management of staff with mental distress, and build an inclusive and friendly working environment. Organizations are required to commit to completing a specified number of action items before they are awarded the title of Mental Health Friendly Organization or Mental Health Friendly Supreme Organization. By the end of January 2025, some 1,800 organizations have signed the charter, benefiting more than 730,000 employees. 502 of these organizations have become mental health friendly supreme organizations. The occupational health clinics of the Labour Department provide diagnostic treatment and counseling to working people suspected of suffering from work-related illnesses. Employees with mental health problems suspected to be caused by work stress may seek consultation there. Doctors and nurses will understand the conditions of the employees and provide counseling on prevention and management of work stress. When necessary, employees will be referred to the HA for follow-up actions. As regards employment support for employees with mental health problems after recovery, the Labour Department, in collaboration with the Equal Opportunities Commission, organized a meeting of the Human Resources Managers Club in December 2023 to brief employers on the salient points of the Disability Discrimination Ordinance and to introduce to them how to support employees with mental health needs in the workplace. For example, reasonable work accommodation and employee support. We learned that the EOC will launch a guidebook on supporting employees with mental health needs in the workplace and an animated video within 2025, which explains the negative labeling of mental health problems and discriminatory behaviors on the ground of mental illness, share the experience of employees or employers, as well as examples of provision of reasonable accommodation, so as to encourage employers and employees to work together to create an inclusive workplace. Some members mentioned that psychiatric injury caused by work should be classified as a statutory disease or statutory occupational disease. I would like to emphasize that in deciding whether to classify disease as an occupational disease, the Labour Department would review whether there is sufficient medical evidence to show that the disease meets the definition laid down by the International Labour Organization. That is, there is a direct causal link between the disease and contact with or exposure to certain risks, specific work environments or work activities. Also, there must be a significantly higher incidence rate of the disease among the relevant workers. When a reasonable inference is drawn according to the ECO that the disease is caused by the work in the patient's employment, then a compensation can be claimed. In short, a direct causal link must be established. Factors contributing to mental illness are complicated and may involve factors outside of work like personal, family, or other societal factors. Mental health issue is commonly seen in society rather than among employees in specific jobs. Generally speaking, mental health issues do not meet the definition laid down by the ILO on statutory occupational disease. However, according to the ECO, If employees suffered from a work-related injury during employment, the employer would normally have a duty to compensate the employee. The injury may be physical or psychiatric. If there is sufficient information proving that the psychiatric injury is related to a work-related accident during employment and has led to temporary and/or permanent incapacity, the employee is entitled to compensation for work injury under the ECO. The claim procedure, the claim items, and the calculation of the compensation are the same as other work injury claims. There is already a mechanism under the ECO to deal with cases of psychiatric injury arising from accidents at work. In fact, compensation has been awarded to some cases involving psychiatric injury at work. If that is the case, an employee should notify the employer as soon as possible for a report to the Labour Department or approach the Labour Department directly for help. Concerning working hours regulation and the right to disconnect, members have voiced different views. We have been attaching importance to protection of employment rights of employees. We encourage employers who advertise job openings at the Labour Department to provide more information on working hours arrangements. A higher transparency usually results in more reasonable working hours arrangements. Furthermore, the Employment Ordinance sets out that before employment, employers must explain clearly the employment conditions, including working hours and overwork compensation, to avoid disputes. Mr. KWOK Wai-keung's amendment proposed regulating working hours and overtime work compensation for various industries, as well as the introduction of the right to disconnect. However, industries and enterprises have very different operating models, job nature, and duties. As a result, different agreements on working hours and work location, including overtime work, are included in employment contracts. The proposal would be very complicated and controversial in reality and would result in a more rigid working hours arrangement. The controversial proposal fails to address the concerns of both sides. In terms of protecting the mental health of women with dual roles, it includes promoting work-life balance and relieve work stress on dual-role women. We have improved benefits in relation to leave under the Employment Ordinance, including increasing statutory leave days, maternity leave, and paternity leave. At the same time, the Labour Department has launched a promotional campaign, including the Good Employer Charter, to encourage employers to adopt good human resources management practice, which is employee-centric and family-friendly. This includes working hours management. The Labour Department will step up promotion to employers and employees on points to note in employment contracts to avoid potential disputes. And also, the HYAB has been supporting the work of the Family Council to promote the caring family culture to society and strive to promote more diversified and flexible family-friendly employment measures. These will help dual women to balance their duties between work and family and lessen their mental burden. Starting from 2023 to 4, the HYAB and the Family Council has been doing that. Now, employees' mental health is affected by many factors, including factors outside of work. To effectively safeguard and enhance employees' mental health, we need to intervene according to the circumstances of each case. We have been providing a multi-tiered, cross-disciplinary mental health services to employees. We will identify room for enhancements to ensure that employees' mental health is protected. President, once again, employees' mental health is a complicated issue involving different factors. Legislating to deal with the issue may not be the most effective way. On the contrary, it may cause unnecessary hindrance to businesses and cause controversies. The Under the OSH Ordinance, the general duty clauses have imposed a duty on employers to protect employees' mental health. We will continue to enhance the awareness and capacity of employers and employees in preventing and dealing with mental health through education, promotion, and training. We will also provide support for employees experiencing mental health issues. Let's work together to create a mental health-friendly work environment. Thank you.
現在請講。
And now call upon Mr. KWOK Wai-keung to move an amendment. President, I move my amendment. I propose a question to you that Mr. KWOK Wai-keung's amendment be passed. Will those in favor please raise their hands? Mr. Peter Shill claims a division. The division bell will ring for 5 minutes.
開始表決。
Will members please proceed to vote? Please check your votes. If there are no queries, voting shall now stop and the result will be displayed. Members returned by the Election Committee, 35 present, 4 in favor, 15 against, 16 abstain. And for functional and constituencies and geographical constituencies, 41 present, 8 in favor, 17 against, 15 abstentions. The question is not agreed by a majority of each of the two groups of members present. I declare the amendment negative. Mr. Stanley, you have 25 seconds to reply. Thank you. I hope that we are protecting the interests of employees. I hope that with the support of members on my original motion, the government will protect the employees better. Your time is up. I now put the question to you that Mr. Stanley Ng's motion be passed. Dr. Wai Kwok has claimed a division. The division bell will ring for 5 minutes. Mr. KWOK Wai-keung. President, I have a point of order. Many members have heard my amendment being negative because the President mentioned that Mr. Stanley Ng's motion as amended by Mr. KWOK Wai-keung be passed. It is not right. It should be that the question should be Mr. Stanley Ng's motion be passed. Thank you.
啱問問議員，
Ms. Common Khan, you have something to say? The speaker's microphone is not on. And I'll put the question to you that Mr. Stanley Ng's motion be passed. Please check your votes. If there are no queries, voting shall now stop and the result will be displayed. For the election committee members, 34 present, 29 in favor, 0 against, 5 abstentions. Functional constituencies and geographical constituencies, 42 present, 35 in favor, 0 against, 6 abstentions. I believe the question is agreed by a majority of each of the two groups of members present. I declare the motion passed.
動議嘅
Members' motion with no legislative